We've talked about this before, but colon cancer is becoming more common in younger people, and it's becoming harder to diagnose. Doctors are not sure exactly what's behind the rise in colon cancer rates, but it is something all of us need to be aware of. We're joined now by 9 News medical expert Dr. Payal Kohli with more on this topic. And full disclosure, I asked Dr. Kohli earlier in this week to have this conversation based on my own personal need to have a colonoscopy kind of in, an urgent fashion. And at 40, it's not something I ever thought of. I thought, you have this something when you're older, when you're in your 50s, and generally the age is 45, but we've discussed it's happening younger and younger where you need to get screened. Why is that?
Yeah, so we're seeing this kind of shift into the younger population. And the harder thing about the younger population, twofold. One, as you said, Alex, we don't even screen them till they turn 45. And yet we know that about 10% of colon cancers occur in people under the age of 50, right? And the second is when they have symptoms, we sort of think it's something else. So it's IBS, it's stress, it's something you ate, it's something else. We don't think colon cancer. And so those are the two sort of barriers to getting younger people screened, which is why I think it's really important if you are having symptoms as a young person for you to advocate for yourself, speak up and ask for that colonoscopy. So if you don't mind my asking, were you having symptoms?
Yes, and it's something like I've been having digestive issues specifically after my second child, and so that's something I went into the doctor, the specialist, this week actually, and it was I think comforting in one regard because they're like, this happens, multiple pregnancies, multiple childbirths. Yeah. I hear this multiple times a day. Yeah. I think less comforting hearing 90% chance it could be something else, 10% chance we could be looking at colon cancer, not necessarily what you want to hear at 40 years old.
Yeah, so I would say if you're under the age of 45, not the usual screening age, but you're having any symptoms, whether that's abdominal pain, bloating, fullness, change in your bowel habits, of course, any blood in your stool, you need to get a colonoscopy because there is cancer that could happen. Small chance, but it still could be possible. We also sometimes do colonoscopies in young people because they're anemic. So you check their blood, and even if they're not having symptoms, but their blood counts are low. And why should a young person that has a healthy bone marrow, which is the factory that makes blood cells, have low blood counts? So it's either menstruation, and if it's not heavy periods, then you might be losing tiny amounts of blood in your stool and not realizing it. So those are sort of the symptoms that trigger us to think about colonoscopy.
You had mentioned earlier advocating for yourself. That really is the best and most important thing that you can do. No one's going to do it for you, right? So how can you tell patients that they should advocate for themselves? What's some advice that you would give?
So first is you have to be informed. So what I tell my patients, so let's talk about colon cancer, for example. If you just go in there and say, I'm 35, I want a colonoscopy, that's not going to happen. But if you go in there and say, I know my own personalized risks. So for example, a young person who's had a family member that's had colon cancer, you actually start screening them 10 years before that family member had their cancer. Wow. So if your family member had the cancer at 45, your screening should start at 35. And sometimes you don't even go to see the doctor in your 30s. So it's really about getting informed and sort of knowing what your risk factors are. And then I like to tell my patients, and I love it when patients are very clear with me about what their fears are, what their goals are, and what they would like. So when people beat around the bush, and they're beating around the bush, I'm beating around the bush, nobody has an outcome. But if you come in and say, Dr. Kohli, I'm worried I might have colon cancer, what do you think we should do? Or I think I need a colonoscopy, and then we discuss the risks. To me, that's a really clear conversation. And then try to be respectful and push back. If you feel like you're not being heard, then respectfully push back. If that's still not being heard, then it's time to find a second opinion or a different doctor.
And I'm curious what, when you think about barriers that are in place that would prevent people from going to the doctor, you think about the potential Medicaid cuts that are happening. For younger people beyond, underneath the 45-year-old threshold, does insurance cover a colonoscopy?
So that's a tricky one, right? Because colonoscopies are expensive. You have sedation, you have the procedure itself in the hospital or some kind of facility, so it's expensive. So it is important for you to find out if it's covered because you don't want to end up getting a big hospital bill after. Now, there are medical indications for which it's covered, and it's important to tell your doctor to put those in the note because then your insurance will cover it. So one being, of course, that family member 10 years before, that's a screening indication. If you have ulcerative colitis or Crohn's disease, which are inflammatory diseases of the bowel where your body's kind of attacking the bowel, you start screening for colon cancer about 8 to 10 years after. If you've ever had a polyp, that's a precancerous lesion, then you need to have a screening done as well. And then there's some genetic conditions where we actually start screening people in their teens because there's such high risk for developing colon cancer. So these are all covered reasons. The doctor has to put it in the note. And I would say if you're ever in doubt, call the insurance company, the number on the back of your card, and talk a little bit to an agent before you go and have that test.
I think it's so important to talk about. You know, a lot of people don't want to talk about this kind of stuff. So kudos to you, Alex, for bringing it up. I mean, I think it really is an important conversation. So I'm glad we had it today.
There's like this ick factor when it comes to our colon, and we really have to think about all the work that it does for us, expelling our toxins. So we really need to be talking about it.
Dr. Kohli, thank you.
Good luck with your colonoscopy.
Thank you. I'll keep you posted.